the front elbows this time around. Here we go.
Right, okay.
Here we go. Good morning. How are you doing? Nice to see you here, Emma. How are you doing?
Prime Minister, did tens of thousands of people die who need not have died because of your action or inaction?
No, I don't think so. But of course, this has been an incredibly difficult series of decisions, none of which we've taken lightly. And you've got to recognise, and I hope people do understand this, that when you go into a lockdown, it's a very, very painful, a traumatic thing for people, for people's mental health, for their lives, and their livelihoods. And of course, you've got to set that against the horrors of the pandemic and of COVID. And at every stage, we've been governed by a determination to protect life, to save life, to ensure that our NHS is not overwhelmed, and we've followed to the best we can the data and the guidance that we've had.
Did Dominic Cummings tell the truth in his evidence yesterday? And specifically, did you say you would rather see bodies pile high in the streets than order a third lockdown?
I've already made my position very clear on that point, and I'm getting on with the job of delivering the roadmap that I think is the sensible way forward for this country.
Tell the truth yesterday?
I'm getting on with delivering the roadmap that is the sensible way forward for this country.
So you're not arguing with the things he said?
The question, I make no comment on that.
Did Matt Hancock promise you that anyone being discharged from hospital into a care home would first be tested? Because Mr. Cummings said he didn't. Mr. Cummings said he promised that, and it didn't happen.
We did everything we could to protect the NHS and to protect care homes as well.
Did you test anyone being put
and
into
we
a
did
care
everything
home?
we could. We did everything we could to protect the NHS and to protect care homes. We put, I think, 1.4 billion extra into infection control within care homes. We established a care homes action plan, I remember very clearly, to ensure that we tried to stop infection between care homes, and we remain very vigilant about infection in care homes.
Are you saying that you could not have tested everyone going from hospital into a care home?
I think that the care homes have been, of course, what happened in care homes was tragic, but we did everything we could to protect the NHS, to minimise transmission.
Dominic Cummings says that you are not the right person to be leading the country at this time.
Yeah.
Can you tell people, why is he wrong?
I think that it's important for us to focus on what really matters to the people of this country. And I think, if I may say so, that some of the commentary I've heard doesn't bear any relation to reality, and what people want us to get on with is delivering the roadmap and trying cautiously to take our country forward through what has been one of the most difficult periods that I think anybody can remember.